We are recording.
Okay, you ready?
Ready.
Okay, so on behalf of the Northern Arizona Peer and Family Coalition and NAMI Yavapai, I would like to welcome everyone to this meeting.
Thank you, Kathy. And I'm Lori. And I think that we'll go ahead and have Kathy introduce Aaron. We have two presenters today working together. And Kathy, if you want to introduce Aaron, then I'll introduce Mayday after that.
Okay, with the pleasure. Besides Erin Soto being my friend, she also is a credentialed peer support recovery specialist and family support partner with over 20 years of experience serving children, families, and adults in Arizona behavioral health system. She is an adult behavioral health advocate liaison with the Individual and Family Affairs for Central Arizona Complete Care. Oh, so I'm sorry, she's with the OIFA department with Arizona Complete Care, and also a board advisor for the Arizona Peer and Family Coalition. She leads their diversity committee and civic leadership development program. Erin believes that investing in people's nature and hearts is vital, that music and meditation are essential in daily life. She values the integration of advocacy and culture, creating connection with the healing journey. Is that beautiful?
And for those of you that were at the Mental Health Day at the Capitol, Aaron created the art exhibit, interactive art experience. So hats off to Aaron. And now I'd like to introduce Mayday Levine. He is the Senior Director of Health Services at Centene Corporation, which is the mothership, I would say, or what do you call it?
The Death Star. No,
anyway, that's the big company that health that let me get my that Arizona Complete Health operates under. And Mayday is a graduate of Antioch University in New England. She was the Director of Integrated Care and Training Director for SAPIC at La Frontera for almost 10 years. And during her career, she has served as child custody and evaluator for Pima County Superior Court, program director at Sierra Vista, which is in Tucson, a 139-bed psychiatric facility treating chronic pain, eating, mood, substance use, and trauma-related disorders. She has been the chief clinical officer of CPSA, Pima County's regional behavioral health administrator. And Mayday is a health insurance administrator with a focus on serving members with Medicaid coverage. Her approach is client-centered and collaborative, believing that each individual and community is the expert in their needs. Her hobbies include reading, walking her two dogs, playing or cuddling with her cat, baking, and annoying her teenage son. She wants to start a desert garden club, but gets overwhelmed by the concept. So, and I know there's more we could say about both of you. If we left anything out, please jump in and add that.
no,
Right.
It was all covered.
All right, so we'll go ahead and Mayday, thank you for creating this PowerPoint. And is this something that you'd like me to be able to send out to everyone after the presentation or not?
Sure, if folks would like it. Actually, there are a couple links, so it might not be a bad idea. I'll send it to you after.
Okay, have at it.
Great. Well, thank you, Lori and Kathy, for inviting us. I'm very excited to be here today. The Community Consensus Collaborative is something that we started a couple of years ago in Southern Arizona, and we're really excited to bring it statewide. Aaron has joined fairly recently and has already really helped make inroads and has been sharing information. And we're just really excited for for the partnership that this brings. So I want to give a really quick overview. I don't want to do death by PowerPoint, but just to sort of share with everybody what C3 is. Kathy was involved at the start. So Kathy, I hope you feel free to jump in too. And Erin, of course, will jump in as I give this overview, and yeah, open for questions. I think Erin and I come with the intent to have a conversation about C3 itself. So bear with me here as we give the overview. So C3's idea is really just to bring people together to solve problems. So we wrote this feeling like as a health insurance company, we work with people from the justice system. We work with people going into or leaving hospitals, behavioral health residential facilities, detox facilities, prisons, jails, crisis events, substance use treatment. So much, kids who are in schools, there's so many partners in the work we do to help people in communities be helpful that we really wanted a way to bring people together to share ideas. So that's what we do. And there's a website there. So when you get the slide, you can go check out more information. And we focus 2 years at a time on different topics, just so that we can, the world is huge. Our lives are very busy. There's always a lot happening. So just to help give us a little focus. So the first time we did this for 2 years, we focused on stigma and value-based purchasing. And so we ended that 2-year cycle with a winter event in 2024 with a focus. And so what we try to do is bring people to share ideas and what they're doing, updates, and then we have conversations about what we learned. So we learned about NIMBYism, which means not in my backyard. So in Tucson, we had a health home that wanted to open up a location, and the neighborhood had a really hard time with this. And their CEO and their COO were able to work with the neighborhood associations and convince them that actually having a clinic in their area would be helpful, and it was. And so they shared with the rest of us how they did that community building. And then we had a training on the Elder Alliance and tackling ageism, so like the right language to use and how to support people who are aging. And then we had a presentation from Text Talk Act, which is a really cool program that goes into schools and teaches kids how to talk to each other about it could just be about emotions, sadness, anxiety, etc., but also really part of a suicide prevention. So I wanted to highlight that because we had at that event, we had 75 community participants. I'm really proud. That's why the number is in purple. We had 22 advocates. We had 34 providers. We had 10 public entities. So people from like county health departments, those types of things. And then we had 9 community-based organizations. And so some of the things we accomplished in C3, and we like to share these accomplishments because the work, it is good to share ideas. It is good to get feedback. At the end of the day, we want to know that everybody's time goes into something, that we accomplish something, that we get something done. So these are just 3 of, I think, 15 hallmark accomplishments we had. We developed and published materials that promote recovery concepts, and we shared that with JTED. We actually shared it with a couple other academic training type of partners, but we know that JTED implemented it, which is really exciting. And JTED is in Tucson, and it's a education program for high schoolers with really hands-on experiential learning. So that's really cool that we shared, the importance of lived experience and the recovery strengths-based person-centered modeled with this training program. So people coming out of there have a working knowledge of the approach. We also developed a commercial about first episode psychosis. I don't know if folks know, but for youth who have a first episode of psychosis, if we can help them and their families get treatment and support, the intensity and the longevity of future episodes are shorter and less impactful to cognitive and emotional health. So really important to have early identification and have a recovery approach to responding. And then Erin can say more about the civic leadership. We offered civil leadership to peers and families, and we call them roadshows or roundtable discussions across the state to get real-time community feedback. And I think that's sort of what we want to do with folks today.
Yeah, I will jump in on the civic leadership really fast. Just it was a great opportunity, and it was a partnership we were able to do with the coalition last year, having 418 participants take part in those trainings. And what is the best, and I think the highlight that stands out for that number, is that means that there were 418 conversations, dialogues happening around advocacy. And whether somebody has a, professional position that is advocacy based, or if it is, sometimes I'll put my hat on as a parent who is navigating the system for the first time. And it was invaluable, the knowledge and the community links that come from those type of trainings.
Thanks, Erin.
Mhm.
Great. And then the next 2-year cycle, we're going to focus on neutralizing risk, empowering and thriving communities. And this really comes out of, I don't know if folks are aware, but in Arizona in 2022, 2023, we had what the state called bad actors. And these were fraudulent providers who picked folks up from rural communities, reservations, treatment facilities, and brought them into so-called sober living. And then paid for people's room and board theoretically through billing insurance for treatment. The treatment wasn't happening, and a lot of folks, some of the living was not good. People didn't always get the food they needed. It was very abusive and cost the state about $2 billion. When I think of how much housing and food and transportation and advocacy could have been provided with that money, I can't think about it too long. It breaks my heart. So really thinking about how we as communities. Oh, Kathy, did you want to say something?
So could you give us, so this is after the fact. And so what are you hoping to get out of this? It seems so general to me that I'm not quite understanding.
Yeah, I think this is, some of the topics do start out very general, and then we use those action events to help flesh them out and see how community partners want to prioritize our response. But I think it's a conversation about how do we all live in a community, right? If we think something's not right, how do we see that it's not right? Who do we tell? How do we take action? How do we advocate for people being safe? And then that thriving part, I think, is also how do we all support our communities staying connected? And I think that's actually very timely given the last several, since October. I think in many ways, a lot of our communities feel divided, feel a little bit disconnected from each other. So how do we really make sure that we're all continuing to be part of our communities and stay connected to each other? And then whole person care. Did that answer your question, Kathy?
Yeah, and this includes more than just the community. It also includes the plans, or just your plan.
We're open to other plans getting involved. Absolutely.
Okay, because that was a real issue, is reaching the plans with the information that we were seeing at our level.
Okay. So it sounds to me, Kathy, but tell me if I'm misunderstanding. It sounds like it would be helpful to have information from all the plans on, if you see something wrong, here's who you can talk to at each plan. Here's how you can get that feedback to Molina, to United Health, to Mercy Care.
And historically, the way that OIFA was set up, it was supposed to go through OIFA. So is that still the case? And what role does OIFA play with sharing that information and escalating it?
The short answer for me is I don't know if that's still the case, Kathy, but I think we can talk to Access and see if that's in, any of the OIFA mission or if that's talked about in the Alliance meetings. Aaron, I don't know if you know the answer to that.
Well,
I
what I'm
don't, but I
saying,
do want to follow up because that makes sense to me that that would be the right path.
what I'm saying is that the role of OIFA when we first started it was that they were the on the ground people interacting with the community and then bringing that information back to the plan. And then the plan would share information and they'd take it back. That kind of relationship is very strong with some plans,
Yep.
and others it seems to be not as strong.
Yeah. I can't speak for other plans, of course. I can say that for ours, I think this did need a little nurturing over the last 6 or 8 months, which I think you've been a really important part of, Kathy. And we now have a number of ways that we are ensuring that the OIFA team is able to escalate the concerns they hear about up through our leadership. And there was something. Oh, and I think with regards to the net idea, with regards to making sure our communities are connected, I think OIFA is our primary advocacy voice, but we've also empowered our community affairs team, who's also, their community affairs, so their name has it in the title, very connected to providers, to our community-based organizations, right? We all have different connections. So we just want to make sure that we don't risk losing any information or feedback that comes to us.
I think one of the opportunities too, and I have recently had, gotten to be part of, is combining OIFA on some projects and some outreach, especially in the community. Like for instance, I've been able to partner with the housing team going out, and even though it's sharing a table, right, and giving OIFA material, it is also that building of relationships that this is new for me, being virtual online, right? The first time I've worked at an agency where that is primary. And so there's such a difference when you can get out, meet people face to face, and be able to share about OIFA when maybe they're coming for housing resources. So I do see that ramping up and becoming more available. And I can speak to Arizona Complete on that end. We also, within this presentation, have, I think it's 5 or 6 questions specific to hopefully have a dialogue and hear from the group that's here about Northern Arizona and how can we increase, how can we work to expand the way that we're hearing information. So, yeah, that's going to be within this presentation as well.
Thank you.
Yeah, great. So we do, to the question that Kathy just asked, we really always want to make sure that C3 is grounded in feedback from the community. So we use roundtables like today. We have surveys. We just finished a survey where we gathered 315 responses. Actually, in my inbox, I have a draft analysis of the results that I'm very anxious to look at. And so, with Erin led us in putting together some questions. And so she's going to take us through a bit of a roundtable now. So Erin, I will hand it over to you.
Okay, I promise not to sing, everyone. I'm just kidding. Okay, for the first one, and really the hope is to get some feedback that we can go ahead and review and see what updates or what changes we can make based on the responses we get in this meeting. So for the first one, how can we ensure our roundtable format and topics reflect the needs, cultures, and voices of Northern Arizona communities? This includes Indigenous populations, rural families, and underserved youth. So I noticed in the last C3 event, that was the first one that I got to take part in, kind of co-facilitating at one of the groups. It's set up like World Cafe, and we did not have members of schools, teachers, paraprofessionals. And we are also noticing that that is an impact that I think would be valuable to hear feedback from, right? Working directly with families, with children. So we wanted to find out in this community right here, how can we ensure that we are extending the welcome to invite to have these discussions when it comes specifically to Northern Arizona? Are there agencies, coalitions, groups, or towns, cities that we can prepare and do more outreach?
Erin, this is Lori. One of the things that we've run into up north is to reach the folks that are receiving services, to reach the folks that we want and that you want to see at the table for the C3. They're receiving services from a health home, and the health home has been, we have not, that they don't provide information to the people receiving services about the coalition existing. If you can create a C3 flyer and get it into the health homes and to the level of the case managers that would then get it to the service recipients, that would be magnificent. And as you know, we've done some forums in partnership with AZ Complete Health up north and run into a where they're just not, they get the information and they don't disseminate it.
I like that, and I'm thinking along the line. So
Oh, Erin, I unmuted you by mistake instead of myself. Please unmute yourself.
Well, I'd like to say, it took us to work with the White Mountain Apache tribe who's in our service area. It wasn't until we hired a member of the tribe as our parenting peer support.
Mhm.
And then, she's not a leader. It's taken her months to coordinate with the tribe about the services. But I can tell you now we get self-referrals.
That's wonderful.
That's great.
So that has come in the last 6 months, and it's increasing substantially. So not only from the ED and hospital, but our peers getting self-referrals. And so it took a while, and thank goodness Summit, as one of Donna Faye Whitesinger is now on our board, and she's a member of the tribe. So the stigma we had with the tribes we serve was horrible. And so it's bringing in more employees using that tribal peers. So
A trusted member of the community.
absolutely.
Okay. And
Yeah, I just, if I could share, my name is Andrew, and I'm a peer support and recovery coach and developer of drumming sounds. It's a evidence-based approach to utilizing recreational drumming. And one of the things that Lori said was very important, that there's an existing infrastructure that is lacking training when it comes to the development of assertive community members within housing We have these low-income HUD housing communities that all have a day room that could easily be accessible to talking circle, drum circle, chair yoga, Tai Chi, so many different wellness programs could be facilitated in these communities. Yet the community service representatives are handing out rolls of toilet paper and cans of soup, and they're putting out, fires basically. And a lot of them lack the training to understand how to deploy information. They don't understand how to develop community. And there are those that are very innately gifted to do it, but they're like a diamond in a rough. Over my 15 years of facilitating wellness-based programs in low-income HUD housing communities, mental health communities, drug and alcohol treatment facilities, schools, there has never been an official motivation to develop community building. This is what we need trained in. Our communities need trained in how to develop community. And if we were to get those key people at these community organizations, Mr. Gallegos at Maricopa County Public Health did a really good job of training community liaisons with the public health initiative. But it has since gone underwater. But that's the kind of integrative approach that really is a necessity within this timeline. I've been going in and doing drum circles with the marketing budget of insurance companies, Medicare brands. And I've been funding my wellness-based programs for over a decade through that strategy. And I can tell you that it's very challenging because a lot of brands don't get it. Some do, even though they're mandated federally or not mandated, but they're asked to do community engagement. But creating an infrastructure. So if I go to a community and that community has an activities person, then it's usually a win. But the activities people some of them are really good at setting up decorations. Some of them are really good at creating personal relationships, but I'm not sure any of them have ever been formally trained in community building. And
I think Andrew, if I can jump in for a moment, I think part of building community is the fundamental in peer support, right? We learn about that and the importance of community. So I think that you're spot on by how do we utilize the community partners that are in place, right, in every community already? And then how do we expand and share the information with that approach? That it's not just a flyer for an event, but that it is building the voice and creating those connections.
Well, paralysis through statistics is definitely something I have experienced. And if we are gathering information, and that's our sole mission statement is to gather information, then we're not actually doing anything. So like I've been putting upon myself to do something in the community by creating these wellness-based programs. Now, I think that what you're saying is very important because these questions of how we relate as a peer are vital in how I conduct myself. When I go into a community, the first thing I might say to the community members is, man, I was really nervous before I got here, but all of you seem very friendly. And the reason I do that is because I want to acknowledge the nervousness that they're experiencing. I want to acknowledge what's going on inside of me emotionally to get that emotional buy-in. Now, I think that if we were to incentivize these community developers in some way by participation numbers, I think that would be a good metric. Also participation from a community member. For instance, Mercy Housing has a dollar system. They give out dollars to their community members that can be used for purchasing donated items from their store. These are Mercy dollars. So every time they show up for a wellness program, they get a Mercy dollar, which then in turn can be a part of their incentive incentivizing them to be a part of their own mental health. Myself,
Well, Aaron,
uh,
you know, I'm thinking that maybe you guys could get together and kind of, talk about some of the specifics, um, and hone some of this and maybe come back the next time and do a little presentation.
Mm-hmm. I think that's a good
Yeah.
idea.
I think so too. Yeah. Andrew, what community are you in?
I'm all over the state.
Okay.
I have drum and will travel. I've turned my life into a traveling wellness-based program. So right now I'm
Right.
facilitating mental health interventions at a variety of music festivals where I talk to youth about suicide prevention and substance use. I don't talk to them about being, drug-free, because a lot of them are here doing this stuff. And I talk to them about being conscious with the way that they show up in that conversation. I also make myself available to distribute information as far as treatment, but my main emphasis right now in the summer months is suicide prevention with youth. But primarily my healthcare business is located in Maricopa County, but I just was in Sedona working, and also in Cottonwood working.
Okay, so I'm a little concerned about all the specifics that are being shared. Everyone has so much to share. If we could go ahead and go with the program and then have some side conversations with you.
Well, I thought this was a roundtable here, Kathy. I thought we were supposed to be having conversation.
It is, but I want others to
Okay.
have an opportunity to share. And
Okay, I'll
we only have
put my mute on.
we only have so much time, and there's so much information to share.
Please get with me. I'll put my email in the chat.
Wonderful, thank you. You brought up some great points. So Mayday, if you want to continue with the presentation, or Aaron, I'm sorry.
Yes, that's okay. We'll move on to question number 2. And I went ahead and put in chat, anyone who's just joining us, this really is Mayday gave an overview about the C3. And this part is, I think we have 6 questions total that are to get feedback. So we're definitely taking the information. So here is question number 2. What are the best ways to engage schools, teachers, counselors, and leadership as partners in supporting youth mental health and wellness throughout our roundtables? So I see that you're on with us, Trish, and I would like to pick your brain a little bit for this one, please, with Vic. And I shared a little earlier in the most recent C3 event that we had, we unfortunately didn't have anybody that was working in a school position, administrator, teacher, paraprofessional. And so it's something that we would really like to focus on in doing some outreach around. Do you have ideas about this, Trish?
I think one of the things, it is difficult to get folks within the school system to even be able to participate in child and family teams, because with the scheduling, they're working before school starts, after school ends, to do IEPs and all those kind of things. So that has always been somewhat of a challenge. I think for our part, we can gather some of the folks that we have connections with at some of the schools to see if we can get you maybe a list, or help try and connect you guys to see if they have someone that they could put available to attend some of these. We do have a couple of schools that we have staff that go into to work with the kids so that they can stay in school. But now that it's summertime, that might be a little challenging, but we could take that time and kind of gather some connections to get those over to you guys, at least in the Yavapai and Flagstaff area.
That would be wonderful. Thank you. And another thing to think about too, I didn't include these on the questions, but I'm kind of thinking about it based on your response, Trish, around time of day as well. Like I know with the civic leadership development trainings, it was requested that those happen later on, so that, it's not a rush so that someone has to be on a training or participate, at 4 o'clock. So kind of think in that space too. What can we do to make it more
Right.
accessible?
I think one of the things we always run into when we're being asked to get families to participate in any kind of events, training, roundtables, we've done them, in the daytime. We've also done them at night, and participation varies because everybody's situation's so different. We have a solid group of families up in the Flagstaff area that actually all agreed to meet at 8 o'clock at night, and they were doing that virtually because their kids were already settled, and then they could get on for their support group. So that was very unusual. Not too many people want to do things that late at night, but that's what worked for them, and our team was willing to accommodate that. So I do feel like we do an awful lot of things when we're asking for youth or parents to participate, and they're in school and they're working. So that is really hard. I don't have a magic answer for what the best time is, because we've had, like I said, we've had to do Saturdays. We've done it during the week. We've done it later at night. We usually kind of look at families that we're talking with, what they need, and we kind of get with them on what works for you. When should we try this? And we go from there.
Thank you, Trish.
Mhm.
Great information. Libby, I see your hand up. Please go for it.
Hi. So one of the things that I found really helpful back in the days when I was doing volunteer advocacy work in the special ed arena was connecting with those special ed teachers and department heads at each school, not only to reach the special ed population, but the whole population of the school. The sped teachers tend to have some, their feelings align with ours, and they seem to have the enthusiasm and the will to bring these kinds of things up to school leadership. So it could be a good, foot in the door at schools you might not have another contact at. And one way that the way I did it when I was volunteering, I would speak to other parents. So we could speak to the parents of and families receiving services up there to identify some special ed teachers or administrators who might be particularly open to hearing of these initiatives and programs, and at least get our foots in the door that way.
All right, I want to make sure I have not missed any. No, don't see anything in chat. I think we are okay moving to the next question. How can peer-run and family-run organizations be invited to not just participate, but to co-lead and co-facilitate the aspects of all the C3 roundtables, and really to reflect that lived experience leadership?
So
So
this
I-
Tricia again, I'll say, and just invite us. That's that would be the easiest thing. We've often, with other health plans, we co-facilitate other groups, other meetings in the past as a family-run organization. So I know FIC would be willing to do that.
How about I was
That's
just
great.
wondering, someone from Peer Run like Trish with someone with a health home partnering them. So they have to work together to develop whatever they're going to develop, and it develops an alliance there. And then, through that association, it brings in more people.
It's a great idea.
And along
Especially, I think if we do that, having the health homes disseminate the information, as Lori pointed out, I
Yes.
think that could really help
Yes.
with that. Sorry, Erin.
No, that's okay. I was also wondering, is having a forum style, like maybe having a C3 event, but also kind of having the training opportunity similar to the forum that took place in Mojave County, is what I'm thinking about. I think there was another one also in Yavapai, if I think back, where it was, there's the civic leadership development. There are tables there to provide information, and then also having this round table. I wonder if that might be helpful. I think I'm processing out loud.
I think you're
Well,
onto something, Erin, though, because there seems to be interest in, rather than having one event every other week, sort of combining for bundled events. There's probably a better term, and I think I just talked over somebody. So apologies to whoever that was.
no, that was just Susie. We contract with peer-run organizations. That's how we partner. Because once we did that, Hope Inc., our peer-run organization we're working with, they have been able to blossom throughout the community because they've partnered with the hospital and they've earned the respect because of our outcomes.
And Susie, this is Lori. I just want to say that we so appreciate what's happened at the Show Low Summit
Yes.
Hospital there regarding this. But it's important to recognize that funding is a factor. And there was a HRSA grant that made that happen, that made that possible. And this is another aspect of when we put these things together. We want sustainability, we want inclusion, and we want growth. So funding
Yes.
in this day and age is a nightmare. And so just to plant a seed there for,
Well,
where's the
one
money?
other little seed I'd just like to plant is that Deb Jorgensen was really one of the founders of that. And
Yes.
comes from this health complete care. And I just want to acknowledge that because, sometimes peers in these organizations initiate these things and put all the work in, then other people get the credit. They take off on it. And so a little kudos to Deb.
Oh, absolutely. And the reimbursement's coming. We have developed between Hope Inc. and Summit a way to get reimbursement with the help of Access. They have helped coach us on how to get reimbursement. And so we will share with all of you how that's going to happen.
Looking forward to that. And Susie, I think that the success being that you've reduced the recidivism of people overdosing coming into the ED, and so the hospital is saving money. And the people whose lives are impacted are experiencing a greater quality of life. So there's that win-win. And I see, Trish, you have your hand up. Go ahead.
I was just gonna jump on the idea about the funding piece. I think, as Family Involvement Center being a smaller family-run organization, funding is huge. We're willing to do stuff statewide, do those things, but implementing programs and getting the word out and taking people that we have offline to build those programs is super costly. And I think that's, for a long time, it's been kind of expected that family runs just kind of go out and they do this for free. And we can no longer do that. The administrative burden that we have now is much higher than what we used to have. Pay rates have changed. Processes to even do our basic but very powerful youth program in the summer has had to be totally revamped because of health plan changes and processes of being able to use certain codes. And so our families are really struggling now to find other alternatives for their kids along with our program. So I just think all of those things come into play, and funding is really, really huge. We went from maybe a 20 kid program for the summer. We're down to 6 kids now, because those kids have to go somewhere else because of the changes with different health plans.
Okay, so this is a very good example where we've got funding cuts and families are being impacted. And I think we need to be really cognizant that we need to work together to, I can't blame the health plan for making these cuts, but we have to be very cognizant when they do this kind of stuff, the impact. And especially now when we're losing money for non-Title 19, we have got to share with them and really communicate, because our families are ending up without services.
Well, and guys, you said our program, patients first are getting care, and then Summit saving money. That's true. But the biggest savings in our analysis went to the payers.
Yes.
I presented Arizona Complete and Healthy Choice, and they saved over $4 million in a year by just reducing the time patients were in the ED, where we could get them to resources quicker. And so by partnering now, we lost the ARPA funds for 2 of our peer supports. So by partnering with the healthcare system, Summit was willing to come up with that money because it has been such a great program. And with public health and with the consortium, none of this could have been done. But by us partnering, we are able to help each other during these horrible funding times.
Well, I'm not sure who's going to be helping families that aren't getting services for FIC. I mean, this is just, I used to go and sit in those little programs where the kids came to daycare, and I just can't believe it. It's not happening like that anymore. Sorry, Trish, but it opened up my heart.
I'm sorry too.
It's important for you to be here today, for everybody to share in this. I think there's going to be quite a bit of takeaways that we are jotting down and follow up. Let's go ahead and lean into question number 4, because I believe that we open that up. What incentives, supports, or formats, whether it be virtual, hybrid, stipends, transportation, would help reduce barriers for grassroots participation from rural and tribal communities? So, would stipends be helpful? Is there a barrier? I do hear about transportation from time to time. What are you hearing as a barrier to attend an event? Or would it be helpful that there were stipends? Should we take a look at making opportunities available on a Saturday or after hours on a weekday? If there's anything that we haven't heard yet.
Well,
Erin,
Aaron, I think that's specific to each community. Some communities have transportation. We don't up here. And it's what's available and how we can work together to provide and take care of some of these issues, not a blanket thing that applies to all the rural communities.
Well, you're right, Kathy, and I'm thinking specifically from anyone who's on this call right now. So whether it's Yavapai County, I guess in my mind, I'm kind of breaking it down by county, and I realize even so, right, it can't be a blanket, but with the individuals, with the families that are being served right now, pertaining to this question, with everyone on this call.
Well,
Sorry, this is Carrie in Cochise County. Transportation is a huge issue here for us. People wanting to come to the NAMI groups aren't able to because they have no way to get here. Bus transportation ends early, so they may be able to get here but can't get home. And I have a small car, so I can only drive so many people, and it's on my dime. which I don't mind doing when we need to do it, but it is definitely a huge issue for us. And then also the virtual and hybrid, I think are great, but there's so many people that don't have the financial ability to have the internet. And even if they have the internet, they may or may not have a device that works for them to be able to do the virtual and hybrid groups.
So I'm talking too much, but I just want to add that I was just down there meeting with Carrie and people down there in Cochise County last weekend. Spent the weekend meeting and talking about some of these issues. And, you know, NAMI is in a unique position that they've got family, they got support groups, but they're not getting support from the plans. And if the plans came together, and just like Carrie pointed out, there's problems with transportation. Why can't you partner? I mean, because these NAMI is offering something that the health homes and the providers are overwhelmed. They're offering something to take some of that burden off. Why aren't there partnerships to work together to provide so NAMI can do its job?
I had to make sure I'm not on mute. Carrie, I will find your contact information and reach out, and I'm happy to take lead with the other Southern Arizona health care plans and work with you and others to see what we can do.
Thank you. That would be great.
Absolutely.
Trish, please feel free.
I was gonna say stipends.
Mhm.
Families are struggling, they can't afford food, rent, anything, so I think any stipend would help. I know we used to do a lot more of those back in the day. If you want parents to participate, I think we need to be respectful of their time and pay them for their time, just like professionals get paid to attend all these meetings. I would agree with what's been said. I think virtual, hybrid, like I think you just have to be open to doing things all different ways, all different times in different communities, because they're all different. The other piece that I hear talked about a lot more in Maricopa County, but we've never talked about it much in Northern because it was never an option, is Child Watch. Having funds available to have even staff if it's at a location where parents can bring their children and we can feed them. That's a huge thing if it's in the evening to be able to do that for their participation.
Mhm. Thank you, Trish.
Along the
Okay.
line with stipends, you know, people like to be rewarded, people like to get something with a monetary value or other. What I'm suggesting is just something we've done at some of the forums is where there are raffles, free raffles, items that have been donated. And that will draw some people. If you can advertise that somebody is going to win a flat screen TV.
Mhm.
That was, and this is something that one of the Peer and Family Runs donated, flat screen TV for forum. There were other things, baskets, gift baskets, but just free raffles with items and have one kind of grand prize, and that's just a carrot to bring people in. And
Definitely.
with your hybrid and with the transportation issue, if you can bring people in to a location where they don't, I'm one of the, say I'm one of those people without the internet, transport me into a location where there is internet and a room full of people, and then we're connected through someone else's internet.
Mhm.
Like get them to NAMI, get them to the NAMI, Southeast Arizona has an office space. Get them there. They have the internet. They can connect to the whatever bigger is going on that they can't get to geographically.
All very important. Which community spaces, schools, community centers, health clinics, cultural events could be a trusted location I think we already identified a peer-run organization, family-run organization being places as well. Are there opportunities that we are not thinking of? I know the weather's changing right now, but is there something outside of this right here, outside of peer runs, outside of family runs, that we need to take into account or explore how we can host there?
Well, I know up in the Sholo area, there was I'm trying to remember the name of the place where we had a forum, and the center, Susie, maybe you can help me with what was the name of that place? It may be in Lakeside.
The Reese Center.
Yes, the
That's
recent.
in St. John's.
No, the Reese Center in Pine Top. St. John's is Arizona Care.
That's
A-
right.
Care AZ.
And the recenter is a community location. They do lunches, they do food boxes, they have all kinds of things that go on there. And it's not a school, it's not a health home. So, and it doesn't exist in enough places. I just am familiar with that one because we did a forum there. But that's an example of, find what's in the community.
Mm-hmm.
Senior centers and community centers can be great places. And again, low income HUD housing.
Mm-hmm. Thank you, Andrew.
I can add, Erin, here in Nogales, we do a lot of events like with the Boys and Girls Club. There are resource fairs held with like the Mariposa Community Health Center is the health center, but then there'll be a resource fair open up to the entire community and everybody can sign up to table. And then hitting the rural spaces. So like today there was a resource fair in Patagonia, bringing it to the smaller areas and gathering everybody that's here in the more centric area, but then going to the smaller Sonoita, Patagonia that's still in Santa Cruz County.
Mm-hmm. Thank you, Cassandra. All right.
Are we ready
Double
for our
check.
last one? Oh, sorry.
Yes, I sure am. How can we use storytelling, art, food, or other culturally relevant community traditions to make these roundtables feel more welcoming, healing, and inclusive? So Trish, I think you were spot on about the food and the childcare. You know, my boys are 12 and 14 now, but I know participating where I knew that I could listen to the information and didn't have to have my eyes on them for the whole duration was definitely helpful. So we've heard about forums, we've heard about food, we've heard about being flexible in the time. And I think one of the biggest things for our takeaway is working with the existing peers and family members in each community to plan these and to host them. How about when it comes to storytelling? A lot of times we use that in the form of our recovery story or our lived experience. How do you think it would be received, or would you want to take part in creating an opportunity to tell recovery stories in addition, maybe on the front end or maybe following the C3? So instead of the idea of having the table set up forum format, but maybe having an event where we celebrate together as a community and then gather feedback. These are ideas being shared out loud.
Well, Erin, I think the storytelling is one of the things, and the art, the food, all of these things are what connect us with each other. So we look at what are the elements that connect us to each other
Mm-hmm.
and how to share them with each other.
I
Storytelling.
think that this, oh, sorry, go ahead.
I just said storytelling has been the most relevant way to show the outcomes.
Yes.
I think there's a huge lack of real celebratory wellness supported by the statewide mental health community in Arizona. As a nationally recognized mental health speaker, I go to communities around the country and I experience these amazing festival style conferences where people are coming together. There's data that's gained, there's food that's exchanged, there's messages, awesome experiences. And I am baffled why the state of Arizona does not have some sort of experience that brings us together statewide.
Andrew,
And I think that
were you at the Capitol, the day at the Capitol that the coalition presented in April?
I
Because-
love the idea of a legislative experience, and I offered to bring drums, and I was told it wasn't an experience where drums were available.
Right, but did you go to that event?
I did not.
Okay, because that event is a celebratory event, and if you go to our website and you see the video of storytelling that people did, it's all about recovery. The legislators were not well, anyway, the focus
Well,
is
it
recovery.
wasn't presented to me that way.
Okay,
It
well,
wasn't
we hope
conveyed
that
that way.
we hope that next year you'll be able to come and just enjoy it, the food, the stories,
Well,
the
I would like to bring 300 drums and get people
Right.
drumming together. I made that
But it's-
offer.
right, and it's not that's not the format for that event, and that's what we did explain to you. So, but we appreciate what you do and who you reach. But you're just saying that there is no celebratory event, and I'm pointing out to you that there is, and we do that, and I agree with you, there need to be more. So I'll let Erin take it back again. Thank you, Erin.
Thank you. So I think if there's anything that we did not capture in these 6 questions, again, I think this was Mayday and I went into this presentation thinking the overview is the brief part. Next is what can we do to really be intentional, to have some dialogue and then have some follow through with the communities. So I would say if we have a few minutes, if there's anything that we didn't cover, that questions that you have around C3 or what are the follow-up steps, anything like that, I think we can leave the floor open for a moment. And we can think also in terms of reaching specific populations. So if there's something that can be done for youth specific, for families, for individuals. And again, I promise not to sing. I will not take up our time with that.
Erin, I think as Trish said, you know, each community is specific. Each community has its strengths and its specific needs. I just hope that we can start now before the cuts actually happen. They're already starting to happen. That we come together with our community, like Yavapai County, maybe even smaller with just 3 communities. But look at our resources, how we can support each other, and how the health plan could help facilitate, write grants or whatever, get transportation and help bring all this together. Because if we don't, we are so fractured. We're so anyway. We have to. When we had the non-Title 19 cuts, I was there. I lost friends. They went to prison. They committed suicide, and we lost them. They just disappeared. So what are we gonna do? And right now you guys are in a unique position. I think this would look really good for the RFP cycle to see you out there and putting communities together to meet this challenge, because it's not going to be over overnight. You know, this is long term.
I think we have an opportunity to really utilize OIFA in this space. and to partner with a community engagement team and, you know, see what kind of adaptability we can use through the C3 model.
I agree.
And I think
agree.
in doing so, it's sharing information, receiving it, but also speaking to your point you made earlier, Kathy, about creating the partnerships. I loved the idea, right, of partnering. I'm just going to pretend with Trish right now, right? But having Trish side by side with somebody who is at one of the health homes, right? And to start building relationships, start refreshing, you know, all of the things that need to be done so that collaboration is happening and our members are being served.
I agree. And I think this conversation really highlights too that the power of C3 is bringing people together because we each have different connections, perspectives, you know, Trish, your perspective, and I'm trying to remember who referenced, I think it was Libby referenced the special ed teachers and departments, you know, so that part. And then Carrie being in Southern Arizona and bringing that experience, Susie being in Northern Arizona and hospital based. I mean, this is the richness of C3 is different. We represent and have connections to different parts of the community. And, you know, as we see things shift, as we see funding going away, I think the best survival skill we have is each other and just that collaboration and taking the time to identify the resources. So thanks everybody for your input. Thanks for being here today. Great. Really appreciate everybody's ideas and thoughts. If you want to sign up, if you haven't been involved, if you'd like to be involved, this is a hyperlink here where it says subscribe for C3 Communications. So when Lori sends this out to everybody, you will have access to that. So if you click that blue thing there that says subscribe, you will get invitations, you'll get a newsletter. We try to really not flood everybody's inbox. So you can let us know if it's too much or just delete what's not helpful, but this is the way to sort of get wrapped into the C3 process. And so we hope you will join. Feel free to share it with your staff, with your friends, with your libraries, your museums, you know, anywhere where there are folks invested in the health of the community. Well, the more the merrier. So thank you, Lori, for inviting us to present. I think that's it, unless there are other questions or thoughts. Erin, any last thoughts for you?
Just thinking that in the Northern Arizona Peer and Family Coalition meeting, in the affiliate in the South, and also in the general meeting for Arizona Complete Health updates, maybe we can have a running C3 update.
Oh, yeah, that would be great.
Yeah, so
Good
we can
idea.
go ahead and plan for that. And that's all I have.
Okay, well, I just officially, that's my official duty is to thank you guys. I want to profoundly thank you. It was really good. And it was at the level where I could understand it. So this is very good. And I think we need some updates from Lori as to what's going on in the community.